Thank you very much, Daria, for allowing me today to share some insights on our fight, which is a collective fight taking place all over the world, but also in Belgium, against the plans of governments to privatize the local and public social care services. So in Belgium, social care services, such as residential elderly care homes, were traditionally provided by either local governments or subsidized non-profit initiatives, often with a social Christian background. Yet, over the past 20 years, for-profit commercial care companies took over huge chunks of the sector, especially in the regions of Wallonia and Brussels, where 49%, and in Brussels, even 68% of elderly care homes are privately owned and commercially operated. In Flanders, the situation is not as bad, with 27% of care homes in the hands of profit-oriented care providers. And it's important to stress out that two kinds of players are involved in the privatization of elderly homes. On the one hand, you have private equity funds that buy and sell care homes as if they were financial assets, much like stock on the stock market. And between the buying and selling of these assets, they rent out the actual real estate to commercial care companies, mainly transnational operators like Corian, Colisée, and Orpea, which often have a French background. And as has been the case in so many other countries across the world, COVID-19 has exposed a festering wound of our healthcare system, which was not at all prepared to respond adequately to the sudden health crisis. The underlying cause, a disruptive austerity policy of budget cuts, which not only fostered the privatization of local public services, but also pushed them to mimic the so-called more efficient cost-cutting methods of the for-profit care businesses. And so healthcare personnel in both hospitals and elderly homes went into the crisis with a lack of personal protective equipment, with major staff shortages and correspondingly poor working conditions. And tellingly, more than 50% of Belgian COVID-19 deaths were suffered in elderly homes. A brutal reminder that working conditions and the conditions for care are one and the same. Important to know, however, is that for every 100 residents of elderly homes, the public sector actually employs 10 more care workers than the for-profit sector does. So, due to its profit and cost-cutting logic, staff shortages are a bigger problem in the for-profit commercial sector, and this lack of staff surely does not help in addressing the crisis in a fitting manner. The crisis which is still ongoing, and there have been many gaps in the staff today. It's still very difficult to fight back against the pandemic, which at the moment is flaring up again in Belgium. So local public care services in Belgium, historically and structurally, also politically, are the responsibility of what we call a public center for social well-being, which is a kind of local government institution. Yet, under the influence of new public management and its drive towards externalization, a new legal form was created that allows local public centers for social well-being to transfer its care services to more autonomous public care organizations. So in big cities like Antwerp, you have a public care organization, which is still publicly owned, that provides various social service, including care in elderly homes. During the crisis, the pandemic, the COVID-19 health crisis, there are actually several examples of public care organizations that responded quite admirably to the challenges. So local public care services were able to redeploy staff to those areas of service delivery where the needs were most dire. Then again, local authorities that have outsourced and privatized their care services to private operators lost their instruments and their means to respond flexibly and adequately, and were at a clear disadvantage to safeguard the well-being of their citizens. Nevertheless, on the 25th of November last year, the parties of the Flemish regional government submitted a new decree, a new law that will allow public care organizations to establish their own private companies, to which they can subsequently transfer care infrastructure, staff, all sorts of recognitions, and very importantly, Flemish government subsidies. And it will also allow a private capital participation within these private companies. And it is important to stress that this new decree caters to the particular request of the Antwerp local city government, which wants to stop subsidizing its public care organization by 2030. This means that this public care organization will have to be self-sufficient by then, and is hence now being pushed to the market to look for a private capital injection. So, armed with this Flemish decree, the Antwerp Public Care Organization plans to transfer its real estate infrastructure to a special company. And private equity funds are invited to buy up 49% of the capital of this private company. The actual operators and the staff of the public services, from childcare to elderly care, are going to be transferred to another corporate structure under private law. And this private structure then will have to lease the buildings they need for the actual service provision from the real estate company at great financial costs. And the results will be higher prices for users and hollowed out working and wage conditions for the workers. And all of this only to guarantee the profits of the private equity fund that will be investing in the real estate infrastructure of the public care organization. So in response, the 3 trade unions of the local public services have established a united front across ideological lines. So socialists, social liberals, and Christian democratic trade unionists in Flanders today are fighting side by side against what we call the privatization decree. Besides our research and many of our opinion articles to raise awareness, both among our own members and the general public, we've reached out to various left-wing opposition parties and convinced them to stand by our side in Parliament. Our combined efforts were instrumental in the decision of an official Flemish council to give a negative advice to the privatization decree. And as we speak, all relevant care organizations in the care sector, including various employers' organizations, have spoken out against the privatization decree. And it is fair to say that we, the trade unions, have led the groundwork for this. Our analysis have really provided a very fruitful frame to gather support and to build unity within the broader civil society of the care sector. Importantly, as trade unions, we also organized various actions, including work stoppages in elderly homes across Flanders. And in the lead up to this, we have received support from PSI and the research organization SICTAR in the forms of 2 solidarity articles, which we have managed to get published in the Flemish press. And I want to take the opportunity to thank Rosa Pavanelli, Daria Cibrario, Daniel Bertosa, Leo Hyde, and Karel Florek from PCI, and Jason Ward and Toby Quantrill from SICTAR for their support in all of this. Importantly, and I'm very proud to say, as of yet, no scheduled vote has taken place. We've managed to postpone the vote on the decree again and again. Yesterday, actually, another vote was scheduled, but one majority party has asked to take it down from the agenda. So whether this means the end of the privatization decree is too early to say. So we cannot yet declare victory, But nevertheless, next Thursday, the 25th of November, we will celebrate the anniversary of a year's struggle against this preposterous plan to privatize our local public services. And I can promise you already, we will continue our fight. So thanks you for your support and thank you for your attention.